All right, we are on. I am super excited and pumped. Welcome to this week's episode of Weekly Dose with Dr. Uday. I have a treat for you guys. I have Dr. Onwuemene with us today. We're going to be talking all about sickle cell. So I'm going to start with introductions and we're going to get right into it. So for those of you that don't know me, my name is Dr. Uday. I'm a board certified family medicine physician. I'm based out of Martinsburg, West Virginia. I own a primary care practice and I also own an aesthetic practice. And my goal is to have my patients not only looking good, but feeling good. All right, so I'm going to introduce Dr. Toyosi Onwuemene. She is an associate professor of medicine and hematology at Duke University School of Medicine. She obtained her MD from Duke University and master's in clinical investigation from Northwestern University. She completed her internal medicine residency at Duke University Medical Center and Hematology-Oncology Fellowship training at McGaw Medical Center of Northwestern University. So Dr. Onwuemene is a hematologist and clinician researcher who helps academic clinicians build research programs whether or not they have a mentor. I think this is awesome. All right, Dr. Toyosi, thank you so much for joining us.
Thank you for having me. What a pleasure.
Yay. All right, so we're going to jump right into it. So the key concept today is going to be sickle cell anemia. So I'm going to throw it to you. So what is it for our listeners?
Yes, thank you for asking. So, sickle cell anemia is a disease that affects red blood cells. And what happens is if you go to the genetic part of the red cells, there is a problem in the gene that makes hemoglobin, which is a protein that's really, really important for carrying oxygen through the red cell to all the parts of the body. So, because this protein is defective, what happens is that when the red cells, which are supposed to be very flexible and able to pass through tiny, tiny places to deliver oxygen, when the red cell gets deoxygenated under stress for any reason, it gets stiff and it's no longer flexible. So it starts to break apart. It starts breaking apart. So that's the hemolysis breaking apart. And then there's anemia because the red blood cells that are broken apart are dying. And the problem is that these red blood cells get stuck on their way to deliver oxygen. So the tissues they're on their way to deliver oxygen to are not getting oxygen, and then they're blocking the way, causing inflammation and pain. And so one of the big features of sickle cell disease is pain, and that's really the pain of tissue that's not getting oxygen, and as a result the tissue is dying. And sometimes that affects bone, so there's bony pain, and it can be a big feature of the disease.
Gotcha. So you kind of touched on some of it with the next question. So what are the signs and symptoms of this disorder?
That's a really great question. So, sickle cell disease is really diagnosed when people are children, and many times what happens is there is the baby has their mother's antibodies and a lot of proteins from mom, and some of the healthier hemoglobin really from an early age. But about 6 months, you start to see some of these signs and symptoms, and that includes pain, and it's hard at 6 months to tell why the baby is crying, but a lot of crying episodes related to pain in the hands, pain in the legs, and other symptoms and side effects like that. So because we have newborn screening in the United States, many patients are diagnosed at birth. However, there are many of our patients who come from other countries who may not have newborn screening programs, may immigrate and then be diagnosed. And so, people with sickle cell have different manifestations of disease. Although chronic pain is a feature of it, not everybody has pain to the same degree. And so some people are actually not diagnosed till they're adults.
Wow. Yeah. So as far as diagnosis, you touched on that, where newborn screening is one, and then obviously blood work. Is there anything else we're missing on diagnosis piece there?
That's a great question. It's actually that is it. It's blood work that allows us to see what kind of hemoglobin is present. And some people will actually undergo genetic testing, but really there's a simple test that allows us to see what kind of hemoglobin is present. And there are different kinds of sickle cell, so there are different kinds of manifestations and different kinds of genetic different genes that are affected. So different what I call genotypes, but all one disease. So in a sense, sickle cell is an umbrella term that actually incorporates a couple of different things.
Gotcha. Now, this one is a loaded question. Treatment. What are the, and do your best to keep it, so that our listeners can follow.
Sure. It's
Yeah.
a it's a really great question. So, I think there are 3 categories of treatment in sickle cell disease. One of them is what we call disease modifying therapy. That means that we're actually trying to affect the way the disease works at the basic level. And there are a couple of different ones. Some of them we know how they work, others we do not. But essentially, I won't necessarily go into all the names. There are a whole bunch of them. Hydroxyurea is one of the
Mm,
ones that's been around a long time. We've got a couple new ones like Oxbryta. We've got crizanlizumab. So there's a bunch of new medications that are coming as well. Many of these medications are trying to address the problem of red blood cells getting destroyed and or help the hemoglobin because there's anemia. It's trying to make the anemia better, so not as bad as it is. So that's one category. The other category is kind of what I would call the category of support. So if you have anemia and it's pretty severe, your red blood cells are not enough, and so we transfuse. We transfuse to help patients feel better, to help
mm,
patients have the oxygen capacity that red cells give. So
mhm.
that's kind of the supportive therapy. And other supportive therapies are hydration. So you go in the hospital, many of our patients get IV fluids. And then the other therapy is just to address symptoms. So pain control. So a lot of therapies associated with really managing the pain of sickle cell disease.
Gotcha. You did that so well. Thank you so much for being so concise with that. All right. And this is another one that our audience would like to hear about. Any tips from your perspective to minimize complications and keep, sickle cell patients, feeling their best if possible?
Abs- Absolutely. And thank you for asking that. I think the most important piece of advice I give my patients is to
Mhm.
avoid stress in all its forms. And that is the hardest advice ever. It's really
Wow.
to avoid stress, not just emotionally and mentally, but
Mhm.
also to avoid stress physically. And so sometimes when the
Mhm.
weather gets really cold, it affects our patients significantly.
Yeah.
So any extremes of weather can be challenging for our patients. So in general, if you can live a life of Zen, that may be the biggest thing that you do. I think the
World.
second the second part of that is really hydration. Your red cells love, 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 love to be hydrated. Anything that dehydrates them, stresses them out, can be a challenge and can precipitate crises. So staying hydrated, that's really important as well. And then I think the third piece is having a great team. So making sure that you are connected with your primary care doctor and hopefully a hematologist as well, so that when you do have a crisis, there's a team that knows you, that you trust, that can help take care of you or can help others take care of you. I think those 3 things are important.
Absolutely. Those are all amazing advice. So you guys listen to the expert. She's saying it. So, and we are definitely here to help. Now, I'm actually going to switch gears. My next two questions are going to be more about you. The first one I do ask is, why do you do what you do, Doc?
Wow, that's such a great question.
Mhm.
I'll take a step back and say I'm a hematologist. That means I'm a blood diseases doctor. And sickle cell is one of the diseases that I treat, but many of these diseases are rare
Mm,
and they really affect really a small minority of the population. That's why they're rare diseases. And for that reason, I think many of these diseases are neglected and really many of our patients who are affected really need champions. And so, I really came into this field because I had a mentor who was so strong and such an advocate in taking care of patients with sickle cell disease. And she inspired me to come into the field. And so I want to make a difference for our patients. And that's part of why I'm a researcher, because I want to be able to help more than just the patient in front of me. I want to take a step back and help millions of patients.
that is awesome. So tell me more about the research piece and how you help in that way.
Absolutely. So I'm a researcher in rare disorders. And actually, the rare disorder that I work in specifically is thrombotic thrombocytopenic purpura. That's a deadly disease that we diagnose in adulthood. And what we're trying to do is kind of do something similar to what we've done in sickle cell, only different, but going as early as possible to diagnose people sooner so that they don't have the complications of the disease, which if you find people sooner, you should be able to hopefully avoid some of those big complications. So that's my major area of research. But really, one of the things I want to do is empower more clinicians to lead research programs so that our patients can get the help that they need. Because I think clinicians are really at the forefront of being advocates for their patients. And I think so many more just need to be able to come in and have the resources to help answer these questions so that we can find cures to disease, so that we can find better therapies and help our patients live better and longer.
Absolutely. That is beautiful. Yes, 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 yes. So I totally agree with you. That is amazing. Okay. Um, the other question, so this one is a little bit of a curveball. And so the question is, with all the experience that you've had and all the life that you've lived so far, if you met your 20-year-old self, what would you tell them? What would you
Ooh, I would
advise?
s I would say get ready for the ride of your life. This is gonna be so awesome.
I love it. Oh, that's the best. Oh yes. Get ready for the ride. I love it. I love it. I I usually love to hear the responses because you don't know who you're going to help out there with that question. So, but thank you so much, Dr. Toyosi. This was so amazing. You guys didn't realize this was going to be so good. This from beginning to end was packed full of information. I'm pretty sure my patients and listeners are so happy. So, the other question before I forget is how can people find you if they're looking for you?
Oh, yeah. So I am on social media. I'm on Facebook as Toyosi Onwuemene, also on LinkedIn as Toyosi Onwuemene, and I'm on Instagram and YouTube as Coag Coach. Come find me.
Yay! So you guys definitely check her out. And on our end, if you're looking for a quality primary care physician, look us up. We are here to help at Apple Valley Family Medicine. Our phone number is 304-350-1087, and our website is www.applevalleyfamilymed.com. And I always give a disclaimer that the information that we give is for informational purposes only. Even though we are both physicians, we are not your personal physician. So if you have any personal issues, please definitely direct that to your personal physicians. Thank you so much for joining us. Thank you so much, Dr. Toyosi, for joining. And you guys have a wonderful week. All right. Bye.
Bye. Thank you for having me.